Hi, my name is Margaret Nickel, and I'm a licensed esthetician and laser technician in the state of Colorado. I've been in the beauty business for over 20 years, and welcome to my YouTube channel. I just want to start off by saying I'm not an MD, I'm not a dermatologist or plastic surgeon or nurse. I'm a licensed esthetician, and these are my opinions, and this is my experience in the business. And also, I'm going to be sharing with you my experience in getting services for myself. And I wanted to talk about, how do you know you're getting a good laser treatment for pigmentation? Pigmentation is, I think, the number one dermatologist, besides skin cancer, service in doctor's offices. And there's all different kinds of pigmentation. There's melasma that pregnant women will have. There's pigmentation from lupus. You'll see like a little butterfly pigmentation, red, brown, sunspots, little brown spots or freckles. We're not born with freckles, they're caused from the sun. And I have had a lot of sun in my life. And I'm from California, and I never wore sunscreen. I didn't start using sunscreen until I think I was 43. And I became an esthetician when I was 42. And for a year, I still didn't use sunscreen. Many people have heard me talk about that story because I like that sun kissed look. And the woman that I was working for just chewed me out. And ever since then, I wear sunscreen every day. I don't reapply like I should, but I do wear hats and or scarves to cover my skin, for the day if I'm going outside. Also, in talking about pigmentation and the different laser treatments, there's something called an IPL, which is called an intense pulse light. It's technically not a laser, and it's most commonly used for pigmentation. It can be used for hair removal, but I'm just going to be talking about the pigmentation. And when you get a service about the third day after the laser treatment, the IPL, you're going to start seeing little Oreo cookie crumbs all over your face where they hit the laser. And then eventually your system just absorbs it's great. It's so much quicker than hydroquinone or retinol. And I just love it. But I have had some bad services, and I want to talk to you about what to look for in a technician. And one thing with the IPLs for pigmentation is they hurt. They feel like you're like someone is um, spraying hot bacon grease on your face. It's really uncomfortable, or a rubber band snapping on your skin. Some people like to describe it as. And if you're not feeling that, you're probably not getting a good service. You're probably with someone who's very timid and afraid, and is not getting in there and doing the job. Now, one thing you do have to be careful of, if you have dark skin, if you're African American, if you're American Indian, Filipino, um, Indian, you can actually cause pigmentation. So your esthetician, doctor, nurse, they'll know by looking at your skin color and type if you're a good candidate for this service. I am a fantastic candidate for this service because I'm so light, but I actually have African American in me, and it's on my mother's side, and it dates back into around the mid 1800s. And I was even able to trace my ancestors to, I think, Ghana. And I have some Moroccan in me, but still, I'm still very Caucasian. Have very, very white skin, and I'm grateful for that. I just love light skin. I just look at women with these tans and the spray tans, and if they would just let their skin go natural and just embrace their light skin, uh, it would be so much healthier for them. And there, I've seen many young teenagers over the years, and as an esthetician, and they were so ashamed of being so fair and white, and the kids would, tease them at school. And I say to them, that is the best. Embrace it. It's beautiful. Rock it. Don't be ashamed of it. Don't, sit out in the sun. Don't get spray tans. I've never seen a spray tan that looks good. They just look ridiculous. They're always orange. And you always have just staining, and your palms are white. And I was watching that Leonard Bernstein movie, and I could tell the main character that was playing Leonard Bernstein. I could see the spray tan staining on his arms when he was holding his arm up. And it just looks terrible. So anyway, when it comes to the laser treatment, you after about 3 weeks, you're going to start to see cookie crumbs, and that's all the pigmentation. It was broken up, and your body's going to absorb it. It's just great. If you if you don't see any cookie crumbs, red flag. If the pigmentation is still there three weeks, call them back up. And if you want to go back at no charge, sometimes they might want to charge you, but I would try to go back for a no charge. They want, we all want our clients and patients to be happy. So see what you can do. I'm not going to bother with this young lady that I went to in December. I'm just not going to go back to her. Uh, and if I want to have these services again, I'll just go to a doctor's office without a coupon. So, anyway, I think that's all I have to say on the pigmentation. I also, I've noticed with some of the laser operators in Colorado that I've had work on my skin, they just kind of jump around. They don't go close. And I say to them, "Did you get this area?" "Oh, yeah, I got that." "Well, did you get this?" I mean, I can tell they're not being thorough, they're being lazy. And, after the treatment, 3 weeks after the treatment, no cookie crumbs, pigmentation is still there. And they were just giving me an attitude about it because they're not used to having someone who's had lots of treatments, sitting in their chair. And then also, too, when I asked her about the hair removal, and she says, "Oh, yeah, I did the whole chin." I know she didn't do the whole chin because I would have felt it. And my advice to estheticians, laser technicians, if a client says, "Well, did you get this spot?" Don't argue with them. "I did, but let me go over it." "Yes, I did, but let me go over that brown spot again." And then ask the patient or the client, "How do you feel? Do you feel like you got a good treatment? Do you feel that I missed any areas?" That goes a long way with making your clients and your patients happy. So I guess that's about all I have to say today. I hope you have a wonderful Saturday, and I'll talk to you soon.